So I was interested in medicine at a fairly young age. I decided I wanted to become a doctor in high school, and as I pursued that quest, I realized over time that I was very interested in sports medicine and orthopedics. I had a couple of small injuries when I was younger playing sports, and I was really interested in the field after that. Beyond that, sports is something that I find enjoyable. I'm passionate about sports, and being able to participate in the care of athletes and getting them better and making them perform at a higher level and recover from their injuries is really important to me. One of the major reasons I got into orthopedics was the fact that I felt it was a field where we actually have a problem, we fix the problem, and we restore a person back to their level of function. One of the biggest things that we do for patients in orthopedics, and in particular sports medicine, besides restoring their activity level, the ability to participate in sports at the level that they want to, or just exercise level that they want to, we take away pain. So the combination of restoring function without pain is a major accomplishment for our field. I think one of the biggest challenges in my practice early on was I started in an academic practice. I was the chief of sports medicine at the Rutgers Medical School when I first began my practice. It was a big opportunity and a big role for someone who was just coming out of their fellowship. Some of the biggest opportunities or the challenges at that point were learning how to teach residents, learning how to do research, write papers, and through perseverance and time and listening to the people I was working with and learning from my mentors, it became a very fulfilling and rewarding experience. In the last year or year and a half, I began to perform a new procedure to repair ACL tears rather than reconstruct them. My entire training and education up until about 2 years ago has really centered around reconstructing ACL tears rather than repair them. A newer technology and some newer implants and techniques became available for us to be able to repair an ACL rather than reconstruct it. I was the first in the northern New Jersey area to perform this procedure, and I've been doing it now for over a year, about a year and a half. It's an exciting new technology. It gives us a completely different tool to repair and restore the ligament that we had before. So when it comes to patient care, my major focus is sports medicine and dealing with athletes. Although I deal with athletes of all ages and levels, the key focus for me is customization or identifying each individual's goals from their treatment. Some people may want to return to simply cycling or running, and some people may want to participate in professional or college level sports. And determining how the procedure is performed, which technique is used to accomplish that efficiently and safely is what you can expect from my practice. I customize and tailor my treatment to each individual's goals.